I'm Kobe, and this is my experience in my career field for job shadowing and my job interviewing. And the career field I chose is medical, and specifically like nurse anesthetist, things like that. And I chose nursing because, well, for a few reasons. On my first slide, the first one is impact, and I want to make an impact in society wherever I went, whenever I grew up. I just want to make a difference in the world, whether it be possibly saving somebody's life to little things like just getting them better if they're sick. Also, there's social. I'm just a people person. I love talking to people, and I don't feel like an office job all day would be something that I would like. Availability and flexibility, they kind of go hand in hand. As an adult, I really want to lead like an active life, and outside of work, I don't want my life to be owned by my job. And so I think that nursing and medical field would be a good thing. You can schedule yourself well, and you can ask for time off and like get it pretty easily. So I think that's good. And then of course money. Everybody knows medical field is one of the highest paying fields out there, and I like money. So a lot of people ask me if you're going into the medical field, why would you just be a doctor instead of a nurse? I mean, it's only a few years more college and a lot higher pay. So I made a little bit of a pros and cons or comparison between doctors and nursing. For doctors, they have to go to school for about 12 years before employment, as opposed to about 7 for nursing. And I mean, to me, ages 18 through 35, that's kind of like the prime of your life. You're an adult, but you're still young, you can still have fun. And so schooling, if you're for 12 years of schooling, that's for me it'd be until I was 30 or 31 before I even started getting paid. And, that's going to school and having to work a job to sustain myself. And I just don't think that's something that I'd want to do until I'm 30, because also I want to have to try to start a family younger, and 30 isn't that young. So for pay, on the other hand, like doctors get about 90% higher pay over nursing, and that while that is a big difference, I feel like it's not worth it. Like it's both a good amount, and I think you can live well off of a nursing pay. And even if you do get a nursing degree, you can possibly, if you like to specialize in something, you can specialize in something to become a doctor. Years of unpaid internships before employment as a doctor. So as a doctor, you have to like you go to school for all this time, and then towards the end of your schooling, you have to do all these internships, and which is basically where you go be a doctor somewhere, but you're not technically a full doctor, so they don't pay you for it. They pay you a little bit, like 20 to 30,000, just enough to keep you on your feet while you're in school, but not nearly enough to have a good lifestyle. As a doctor versus nursing, the liability is a huge thing. Whenever I went and job shadowed Mr. Gill, he was telling me about how him as a nurse anesthetist versus an anesthesiologist, if he were to make a mistake in a room with him and the anesthesiologist, that people that would come suing, they'd sue the anesthesiologist before him, and so that anesthesiologist would be getting a lot more trouble than him. And that's a huge thing, because that's how a lot of people's careers end in the medical field, is they get sued, and there's nothing they can do about it. And one of the biggest things that influenced me to become a nurse instead of a doctor is a specialization. As a nurse, there's a wide, like you get your nursing degree, and then you can go anywhere from there. You can go into any kind of specialty, any kind of field, and if you don't like the one you went into, you can back out and go to another one really quick. It's not It takes a couple years of online schooling, and you can do that while you work and make money too. As for doctor though, you spend all those years getting into something specialized. If you don't like that, you're kind of stuck in that unless you want to back out completely and go through another however many years of college just to get back. So specializations. This is just a list of the specializations for nurse, and some things that stood out to me, like nurse anesthetist. That's obviously what I want to be. They deal with anesthesia, like during surgery. Hospice. That's whenever the patients are near death. Geriatrics. It's whenever they are the older patients. Genetics. I thought this was really cool. They deal with like helping people genetically, like not necessarily like designer babies, but they kind of help people like with diseases to help their kids not have those diseases that are going to cut their life short. And I thought that was really cool. So my first job shadow, I job shadowed Dwayne Gill, and I know that's not very professional because but he is like absolutely hilarious. So some of his duties before surgery, he meets the patient, He examines their throat, and what he's looking for is like a little opening in the back of their throat. He showed me. He had a patient let me look, and he looks for the opening and sees how big it is, because during every surgery, he has to intubate them, which is where he puts a tube down their throat for breathing. And there's two machines. One of them is it's harder to use, but it's for like patients with smaller throats so you can get down in there better and not risk hurting them as much. And the other one is just like their typical machine, so they always have to check that. They check the allergies, they explain the procedure, and then a lot of times the patient is really nervous, so they have to calm down the patient. Before and during surgery, so one of the big things that I saw he did, I actually don't have it written on there, but he's always, before the surgery, he's always having to fill up his needles with, or like pre-fill them with the medications he's going to give before the surgery even happens. So that way, if anything goes wrong during a surgery, he has it pre-made, all he has to do is stick it in an IV, and so that he doesn't waste time during the surgery for things that he knows he's going to need. So he transports them there, he gives them oxygen, and he gives them the gas mask, and then like it starts out as oxygen, and then whenever it's time for them to go to sleep, he changes it to something else that helps put them to sleep. Obviously, that's not the only thing. Whenever he does this, he adds the medicine to the IV also, and then as soon as they're asleep, that medicine includes a paralysis medicine that could possibly stop their attempt at breathing, and so he has to instantly like intubate them, which is just putting a big tube down their throat, and it basically breathes for them. So during the surgery, he's constantly monitoring vitals and gas levels and everything, all the medical things, blood pressure, heart rate, everything. And that was it was a lot to keep track of, and it was pretty stressful. He documents numbers every 5 minutes, so like reliability again. He documents every 5 minutes all the vitals and the levels of everything. It kind of takes a little bit of liability off of them. And then he communicates with the surgeon. Like when I was there, they had actually a hemorrhoidectomy, and the surgeon wanted the foot end of the table to come up more higher, but there's a chance the patient would slide off, which is on him if it happens. So he had to tell the surgeon. He said, I can't do that. He has to be very polite. That surgeon's kind of his boss, but he had to tell them that, and so that's a big thing. After the surgery, this is actually the most fun part. You had to slowly wake the patient, which involves taking them slowly off the gas, giving them a deparalysis medicine, and de-intubating them as soon as they wake up, because you have to leave it in there until they wake up, and as soon as they do, they start feeling that, and they start like grabbing at it and everything, but you have to leave it in there so that they don't stop breathing before they wake up in case something goes wrong. They always come up, they all come up different. It's really cool actually, because they come up from a deep sleep, don't know where they are. Some of them come up swinging, some of them come up crying, some of them just lay there. We had one guy that tried to fight us, and it was actually pretty cool. So in my experiences, I saw hemorrhoidectomy, like I said. I saw a gallbladder removal where that was really cool. He had like 3 different punctures, like one in the belly button and then one on each side of the chest, where they went down in there with cameras and lights